This week's blog concerns longevity, decreasing inflammation, and leading a more fulfilling and healthier lifestyle. Today, all of us are concerned about longevity. We want to live longer, but not only do we want to live longer, but we want to live a longer, healthier, and happier lifestyle. The absence of disease helps us get there. And those of us that said that, the man who is healthy has a million dreams, and a man that is sick has but one. And that's, of course, to get healthy. Right now, I feel pretty healthy and I have a lot of opportunity. But if something befalls me where I'm not very healthy, where I'm bedridden, or I'm sick, or I lose my sight or the use of my limbs, or if I just can't run up a flight of stairs like I can now, my life is very different. It's going to change dramatically. All my life, I've worked very hard to maintain as great a health as I can. I'm not sure really what that means, but there are four basic things that I've always learned that are really important to staying healthy. One is to exercise daily. And most of the data that I've read is that if you exercise daily, you'll live a better life. I think that a lot of the reasons why I don't get sick too often is because I do exercise daily. And that exercise is going to be 3 or 4 aerobic workouts a week, 2 of them with HIIT training, high intensity workouts, at least twice a week lifting weights. Because as you get older, pretty much after the age of 30 for men, you start to lose muscle mass. And it's very important to do weightlifting. It's also very important to maintain aerobic fitness. And those of us who maintain that just seem to get sick less frequently. But more importantly, we move, we stretch, etc. Our lives are easier. So exercise is important, but exercise without doing the other things is not really that effective. I have to sleep. For years when I was younger, I used to think it was important that I just got as much work done. I'd say, well, I only sleep 4 hours a night. I only need 5 hours a night. And for years, I walked around chronically tired as I was building up my career and my early successes in dentistry, with family, etc. I had 3 little kids, I worked a lot, and I was always tired. Today, if I don't get 7 or 8 hours of sleep a night, I'm exhausted. Okay? Not that I'm exhausted, but I know what it feels like to feel good. Now I have this little ring on, it's called the Oura Ring, O-U-R-A. I've been wearing it for about 6 years. Peter Diamandis gave it to us at one of his conferences. And I'll tell you, I look at my sleep every day. If I get less than 7 hours of sleep and don't get my REM sleep and my deep sleep, I don't feel as good. So it helps me track my sleep, and I make sure that I do get a good night's sleep. I go to bed at the same time every night. I try to get up at the same time, whether it's the weekend or it's a work day. A lot of people say, well, it's the weekend, I'm going to sleep in. No, I get up at the same time every day, and I think that's important for your circadian rhythm. It's important for your overall health. I also sleep in a cool room, so it's not overly heated. I also put on an eye mask, which I just started doing a few years ago. My sleep is deeper. I get better, deeper sleeps. So I make sure that there are no devices in my room. I don't go to bed with the cell phone on. I don't have a light in my face all the time. So I think that's important. So 1, exercise daily. Make sure that you have different types of exercise, HIIT exercises, aerobics, weight training, and of course stretching. Yoga is important, and if you don't, or martial arts, or any type of light stretching, I think is important. And of course, getting sleep. The third area is diet. And when you say diet, I'm not going to give you my dietary advice because it's all over the place. You can read a lot of people like Mark Hyman in Forever Young. He talks a lot about diet and different ways of doing it. Some people do intermittent fasting. Some people don't eat after 7 o'clock at night. The bottom line is stay off of simple sugars. Try to have a healthy diet, plenty of leafy greens, and not a lot of meat. You can eat some meat, but I wouldn't eat a heavy meat diet. Try a fairly low-fat diet, but the simple sugars is what kills most of us, and overeating, eating a lot before you go to bed. But I'm not going to give you dietary advice, but I think what you want to say is you don't want to be overweight, and you want to eat a normal, sensible diet, and snack during the day, but whatever. Then the fourth thing is mindfulness, and that's what's killing us today. Today, in this environment, I get probably 200 to 300 emails a day. Now I'm getting texts from people, especially younger people are texting. I don't like texting because it's one more thing I got to do. I get phone calls. I have employees in the office. They're all getting 200 emails a day. The phone is ringing both in the office and at home. It's tough to keep up with everything that's happening around us. And I don't really try to because I can't. Because I can get overwhelmed if I start looking at social media, Instagram, Facebook, LinkedIn, TikTok, whatever. It's a lot coming at us. And it's easy to get overwhelmed. So how do I deal with that? I make sure I take at least 2 hours a day for myself. 1 hour for exercise and 1 hour for prayer, meditation, mindfulness, yoga, that type of thing. And it could be something really simple. You don't have to be real heavy about it. Just take an hour for yourself and take a walk. Take a walk on the beach, take a walk downtown, take a walk in the woods, walk in your neighborhood, walk with somebody else. And what we found is that the longevity studies, those four things, taking care of your body with diet and exercise and sleep, and the mindfulness part is very important. And there's a show now on TV that talks about the blue zones. And one of the things that they talk about in blue zones is a sense of community and connection. It's important to be connected to other people. People that do really well have a lot of connections. We also oftentimes say connection is the opposite of addiction. And today we have a lot of addiction in society. And I'm not talking about drugs and alcohol, although that is going off the charts. When COVID hit, alcohol consumption went way up. And with the increase in the amount of drugs that are available to our children today and adults, we're seeing over 100,000 deaths a year due to drug overdose. Now, just about 5 or 6 years ago, we're at 60,000. There's like about a 40 to 50% increase in drug overdose. Why? Well, partly is the access to drugs, but another part is the stress level. People don't know how to deal with the stress. So how do you deal with the stress? Try to practice some of the healthy choices. Now, drugs are just one addiction. There's the work addiction, okay? There's the sex addiction. There's gambling addiction. There's many different types of food addictions that are out there. Almost every adult has some tendency to become addicted. Right now, my current addiction is probably I'm working a little bit too hard. So I have to be careful of that. I have to be mindful of that. So I try to do my meditation, my yoga, and I try to put that into my work week. So if you're going to make these changes in your health and your overall life, how do you do that? Well, first thing is write it down, create a plan, and schedule them. Schedule your workouts. Say, I'm going to do my workout between 6 and 7 o'clock. Well, say 6 is too early to get up. Well, then go to bed 8 hours before that. Then it's not so early to get up. So if you go to bed at 9 o'clock at night, 6 o'clock's not that early because you've already gotten 8 hours of sleep. So you want to be very mindful about when do you go to sleep at night, because most people stay up, I got to relax, I just get home from work, we eat at 7, 8 o'clock, and then we sit down in front of the TV and we got to talk, and it's my relaxation time. And then you get up exhausted the next day because you ate late and you didn't do proper type of relaxation. So in our future blog, I'll talk about the 4 quadrants that Stephen Covey talks about. But today, I just want to limit it to some basic healthy habits. Now, how does this relate to periodontal disease? Well, periodontal disease is an infection, and it affects over 50% of the population. And patients that come to see me, the average age is 65, they have severe periodontal disease. They did not decide when they were 8 or 10 or 15 or 20 years old that they're going to have severe periodontal disease and lose their teeth and have to go through painful disfiguring surgery when they're 65. That wasn't in their plan. And we often say that, if I knew I was going to live this long, I'd take better care of myself. Well, a lot of my patients say, I didn't realize this would happen. Well, it happens slowly over a period of time. And they don't look good. People with severe periodontal disease usually don't look healthy because they're not healthy. So when a patient comes into my practice and we talk about periodontal disease, I talk to them about the importance of getting their health under control. Not only their oral health, but their systemic health. It's part and parcel of everything that we do in our practice. And I have plenty of books that I give them, including Bale and Doneen's book on, Beat the Heart Attack Gene, and Younger Next Year, talking about living a longer life. I just talk to them about, and if they have back problems, I'll give them books around their back. I try to talk to my patients about taking care of the whole body. Because as dentists, we're physicians of the oral cavity. We want to get people healthy, not just in their teeth, but their whole body. Because basically, isn't that what we're here for? To help others? But first, help yourself. So in conclusion, remember the 4 things. Eat a healthy diet. I'm not going to tell you what that is. You figure that out. Exercise daily. Get a good night's sleep, 7 hours minimum, and practice mindfulness, decrease your stress level. And above all, decrease inflammation. Those four habits are very important to decreasing inflammation. When you do that, your chances of leading a healthier, longer, and happier life increase exponentially. Thanks for listening to today's blog. Hope you enjoyed it. And remember, be the gift to yourself and to others.